Alright? Ovarian cancer symptoms that every woman should know. Ovarian cancer is a disease in which cancer cells form in the tissues of the ovaries. The ovaries are two almond-shaped organs located on either side of the uterus. They produce female hormones and eggs. Ovarian cancer is hard to detect in its early stages and can spread quickly. Ovaries contain many small glands that produce and release an egg each month during a woman's menstrual cycle. The ovary also produces female hormones such as estrogen and progesterone that control a woman's cycle, fertility, and pregnancy. In most cases, ovarian cancers begin as abnormal growths in the cell's lining, the surface of the ovary. These abnormal cells may eventually become cancerous if they continue to grow unchecked, or if they invade other tissues or organs of the body. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. With that said, let's jump in and talk about 9 common signs of ovarian cancer. About 6% of women will develop ovarian cancer in their lifetime. That's about 1 out of every 78 women. Ovarian cancer is more common in older women and among those who have never been pregnant or who haven't had children. The American Cancer Society reports that around 22,000 new cases of ovarian cancer were diagnosed in 2021, and almost 14,000 women lost their lives. Ovarian cancer accounts for about 2% of all cancers among women in the United States. The good news is that many women with ovarian cancer can be cured, but you need to get treatment as soon as possible after symptoms begin. Ovarian cancer often has no early symptoms until it's too late for treatments to cure it. Most women that are diagnosed don't have any symptoms until their disease is advanced. On average, the 5-year survival rate for ovarian cancer is about 35%. The survival rate depends on many factors, including how advanced the disease is when it's diagnosed, a person's general health, and whether they choose surgery or chemotherapy as their primary treatment method. Ovarian cancer is most common in women over age 63, but it can occur at younger ages. Family history also plays a huge role in the formation of tumors in the ovaries. If a close family member has had ovarian cancer, your risk is higher than average. If 2 or more family members have had it, your risk is even higher. Fortunately, there are many early symptoms that can signal the presence of ovary cancer. But to better understand these symptoms, let's take a look at the types of ovarian cancers. There are 3 types of ovarian cancer. The most common form of this cancer is epithelial ovarian cancer. This type accounts for about 90% of all ovarian cancers, and it begins in the cells that line the surface of the ovary. Germ cell ovarian cancer, however, is less common. Germ cell tumors start before birth or very soon after, so they can be found in children and adolescents. These tumors account for about 8% of all ovarian cancers, but most cases occur in women in their 40s. The rarest type of them all is stromal ovarian cancer, which accounts for 2% of women diagnosed with ovarian cancer. This type of cancer is mostly common in late adolescence and early adulthood. But since ovarian cancer is often diagnosed at an advanced stage, it is not always possible to identify the symptoms. However, some symptoms are common in early ovarian cancer cases, and they may include: number 1, frequent bloating. One of the most common signs of ovarian cancer is a feeling of bloating on a regular basis. This can be accompanied by pain in the lower abdomen, which is often mistaken for menstrual cramps. Some women may also experience constipation or diarrhea. Although it's normal to feel bloated after eating, some women experience this sensation more frequently than others. If you are experiencing bloating that's accompanied by pain or other unusual symptoms, it's important to see your doctor to rule out ovarian cancer as soon as possible. Number 2, lower back pain. Pain in the lower back or pelvis is often one of the first signs of ovarian cancer. It may be worse after periods or bowel movements, and it can be persistent or come and go. Pain in the pelvis or abdomen usually spreads to the groin area. The pain may be constant or come and go, but it may feel like a dull ache rather than sharp pain. It may worsen with exertion, such as coughing, sneezing, or lifting heavy objects. Number 3, constipation. Constipation is a common symptom of ovarian cancer. Constipation occurs when stool in the colon becomes hard and dry due to a lack of water and fiber. This may be due to the tumor putting pressure on the colon or rectum. The tumor may also cause the muscles in your intestines to contract, which can make it difficult for stool to pass through. Stool changes related to ovarian cancer include having less frequent bowel movements than usual, feeling bloated or full after eating, straining when trying to have a bowel movement, and having fewer normal bowel movements than usual. liking our video so far before we move on to the next symptom. Don't forget to hit the like button and subscribe to our channel, so you never miss out on our new informative videos. Number 4. Fatigue. Ovarian cancer symptoms can include fatigue. The fatigue often comes on gradually and may be accompanied by other ovarian cancer symptoms, such as loss of appetite, bloating, and indigestion. The symptoms of ovarian cancer are vague and not specific enough to bring about a diagnosis. Many women attribute their symptoms to stress or aging. As a result, most wait too long before seeking treatment for ovarian cancer. Number 5. Pain or discomfort in the abdomen or pelvis. Another common symptom of ovarian cancer is abdominal pain. The cancer usually does not cause any pain in these areas until it has developed. Advanced stages. The level of pain can vary widely, and many people with ovarian cancer don't even realize they have it until they're diagnosed at stage 3 or 4. This is why regular screening tests are important, as they can detect the disease before symptoms appear. Number 6. Quickly feeling full when eating. Many women feel full after a meal and can't eat more than half of what they usually would. Some feel sick if they eat too much. They also may have diarrhea, nausea, and vomiting after eating. Feeling full quickly or bloated for no reason are common signs of an enlarged stomach caused by fluid buildup from an ovarian cyst or tumor pressing on nearby organs or other structures in the abdomen. Number 7. A frequent urgent need to urinate. The most common symptom of ovarian cancer is a frequent urgent need to urinate. This can be caused by an enlarged pelvic tumor pressing on the bladder or ureter, which is the tube that connects the kidneys and bladder. While most women do not experience frequent urination before being diagnosed with ovarian cancer, it's still important for women to pay attention to these symptoms, as well as other changes in bowel habits. Number 8. A change in the menstrual cycle. The symptoms of ovarian cancer vary from woman to woman, and some women don't have any symptoms at all. Many doctors recommend women get screened for ovarian cancer starting at age 35, but it's important to know what symptoms you should be looking for. A change in the menstrual cycle is one sign of ovarian cancer that many women don't give a lot of attention to. It's common to have an irregular menstruation cycle while approaching menopause, but it's also safe to talk to a doctor when this happens. Number 9. Difficulty eating. Many women, especially those who are busy or stressed, often experience nausea and an upset stomach. While occasional difficulty eating is nothing to worry about, it can be a sign of ovarian cancer. Ovarian cancer is often an insidious disease, as it may not cause any difficulty eating until it has spread to other organs. In its early stages, ovarian cancer does not usually present with such a symptom. Diagnosing ovarian cancer. Ovarian cancer usually grows slowly and can take years to develop into an advanced stage. The earlier you're diagnosed, the better your chances are for treatment success, especially when it comes to curing rates. The first step in diagnosing ovarian cancer is an abdominal ultrasound. The doctor uses a probe that emits sound waves to create images on the inside of your abdomen. The doctor will also do a pelvic exam and possibly a CT scan. The CT scan can be used to look for tumors in the ovaries and other organs nearby, including the colon, bladder, and rectum. If the doctor suspects cancer, they may be recommending an MRI, PET scan, or biopsy. A biopsy is when tissue samples are taken from suspicious areas in your body and examined under a microscope by a pathologist. Treatment for ovarian cancer. Treatment options vary depending on the stage and type of a woman's ovarian cancer. Surgery is often used to treat early-stage cancers. For advanced stages, chemotherapy and hormonal therapy are used along with surgery. 3. Surgery to remove an ovarian tumor is called a laparotomy, depending on the location and size of the tumor. Your doctor may perform a laparoscopic or robotic approach to removing your ovaries during a laparotomy. Your surgeon makes a long incision in your abdomen, usually horizontally. This allows them to access the organs inside your abdomen and remove any tumors found there. If you have cancer that has spread beyond the ovaries into other parts of your body, such as the lymph nodes, this procedure may be used to surgically remove those areas as well, but if all evidence of cancer has been removed, there's no need for further treatment. Chemotherapy may be used to shrink a tumor before surgery, or it may be used after surgery to kill any remaining cancer cells. It's also given after surgery to help lower the risk of ovarian cancer. Coming back, chemotherapy can be used alone or with other treatments for ovarian cancer. It is often used with radiation therapy to treat ovarian cancer that has spread to other parts of the body. The 5-year survival rate for women with early-stage ovarian cancer is 92% for women with advanced stage disease. The 5-year survival rate is about 17%. Hopefully, reproductive cancers, like ovarian cancer, will be much less of a threat in the future, until that day comes. There are steps you can take to improve your chances for early detection. The earlier it is detected, the better your odds are of beating the disease, so never hesitate to ask questions about symptoms or risks. When visiting your doctor, enjoyed this video, hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching. Your wellness is our mission. Thank you.